Now, still on malaria control, the Western region has been named as the first region in Ghana with the highest malaria prevalence rate, according to the Ghana Coalition of NGOs in malaria. The Western and Volta regions alone accounted for 47.4% of the country's prevalence rate. The Western region alone contributes 27% of malaria cases in Ghana. The statistics has called for an all-hands approach to reduce the malaria prevalence in the region. In Athalia, Konsa has more.
Despite the region being the second highest malaria epicenter, some MMDAs in the region are doing their best to mitigate the morbidity and mortality malaria cases to zero. One of such municipality is the Prestia-Honey Valley municipality, which has recorded zero malaria cases of mortality since 2019. The Municipal Health Director, Joseph Kwame Sampson, speaking to JoyNews at the sideline of this year's World Malaria celebration organized by the Goldfields Ghana Foundation, he said malaria cases in the municipality has reduced significantly in the past 5 years due to the adherence of malaria preventive measures by the residents.
The proportion of cases as in 2019 was 44%. This reduced to 36% in 2000 and then further reduced to 30% in 2001. For admissions, we looked critically at the children under 5 and we realized that proportionally it was around 50% throughout, meaning that we're not seeing much in the drop of admissions, but for the OPD. And for death, for the last 2 years, we've not recorded any death. An indication that some of the interventions that have been taken by the populace and even also the caregivers in some way had worked. Because it is just a 2-year positive improvement, we can say it is significant. It is significant in the sense that our ultimate goal is to ensure that we have zero deaths.
World Malaria Day is marked annually on 25th April to focus global attention on malaria and its devastating impact on families, communities, and societal developments, especially in sub-Saharan Africa. This year's theme, harnessing innovation to reduce the malaria disease burden and save lives. Here is Community Affairs and Stakeholder Engagement Manager of Goldfields Diamond Mine, Abdul Razak Yakubu, on why Goldfields Foundation chose to educate 300 pregnant and nursing mothers in their host communities on the need to adopt innovative approach towards zero malaria records.
The statistics given by the director centered on death, which they haven't recorded any in quite some time. But then the prevalence rate is not so encouraging compared to other areas. And even then, we don't want to lose our focus. Malaria is such a condition that if you take your eye off the ball for just a second, especially when it has to do with sanitation, you will be taken unawares. So Goldfields Foundation, as part of our health interventions in the community, we still pay particular attention to malaria. This event was more or less an education or training session, but then the main intervention is in our water and sanitation programs that we do, ensuring that our communities are clean in order not to breed mosquitoes at people's backyards. Yeah. So we don't just have to depend on the traditional way of preventing malaria. Let's combine all the approaches, keeping our environments clean, getting rid of mosquitoes, sleeping under treated nets, and let's also add the use of repellents, among other things, to fight the pandemic.
The women were presented with mosquito repellents as an introduction to new innovation. For JoyNews, in Athalia, Kwanza, Western Region.